Good afternoon, everybody. Welcome to this briefing. We're sorry that we had to postpone last week's briefing, but sadly it happened to be the death of Prince Philip. And of course his funeral's tomorrow, and our sympathies continue to be extended to Her Majesty and the royal family. But we are here today, and we are broadcasting with a message which we hope is generally optimistic, because what was said previously is that we'll be looking to move to a system whereby our borders are open more than they have been. And the Civil Contingency Authority met yesterday and made firm decisions on the next steps towards removing restrictions at our borders and hopefully restoring at least the ability to travel for our islanders. Now, we indicated when the bailiwick blueprint was published that we would resume the categorization of countries and regions at the end of this month. But that was merely indicative. So this week, what the CCA agreed was that we will reintroduce categories, but in a phased approach. Now, currently everybody's Category 4, which means if you come to the island, you've got to have a test on day 1 and day 13. And if you don't have a test on day 1 or day 13, you've got to be isolated for 21 days. Well, from next week, the 23rd of April, next Friday, we're going to reintroduce Category 3 for countries and regions with a lower prevalence. So what that will mean is the minimum self-isolation period for those arriving from a Category 3 region or country will be 7 days, after which travellers can leave their self-isolation but must observe passive follow-up rules. And Dr. Brink will talk about what's a passive follow-up rule in due course. Now, we've also decided that if there are any horrible problems or major surprises, unpleasant surprises, then we'll take another step on the 14th of May and introduce Category 2. Now, Category 2 means that if you're coming from a place or a region of very low prevalence, you will only need to self-isolate until the test that you take on arrival comes back negative. But then, of course, you will still need to keep passive follow-up rules until day 14. Now, Category 1 in our system continues to be for any place where we set up a formal air bridge, and there'll be no need for any travel restrictions. Well, at the moment, we haven't got any plans to, tomorrow or next week, introduce an air bridge, but that's something we intend to discuss further with our colleagues in Guernsey and the Isle of Man in the coming weeks. And indeed, in my regular conversations with my equivalents in those jurisdictions, it's always an item of discussion between us, because we want to move to that, they want to move here, and we want to move there as soon as it's safe. Now, this approach, the approach that I've just outlined, we feel is proportionate. It recognises the kind of risk we still face, but with falling prevalence levels in the UK and the progress of our vaccine programme, we believe we can move to these restrictions, or the relaxation of these restrictions, quite shortly. Now, the main thing we all want to avoid is a third lockdown. We know how hard the first was. We know how exceedingly difficult the second was. Now, Dr. Brink and our Chief Executive, Paul Whitfield, will deal with some of the detail shortly, including what passive follow-up means and the thresholds for the different categories. Also, the CCA have made some further decisions relating to travel. Again, from a week's time, the 23rd of April, as well as reintroducing Category 3, we will permit business tunnels. They will be to operate into the bailiwick where there's a genuine need to complete or deal with a business activity that can be done quickly and cannot be done remotely. Now, I've mentioned before in previous broadcasts that we've discussed travel costs and testing costs. We're going to be introducing those from the 14th of May. So we're giving people, 4 weeks' notice in relation to that, and the charge we're looking at is £25 per test. So therefore, if you travel away, an individual, it'll cost you £50. Now, so far, the cost of that testing has been met entirely by the taxpayer. But public finances are under real strain, as you'll hear in a different context from me and my colleagues at Policy and Resources early next week. And it's not unreasonable to ask for those travelling to make some contribution, much in the way that people in other jurisdictions have been doing for some time. Now, naturally, we're into spring, summer's just around the corner, and some people will want more detail on what travel will look like from July. We've already said that hopefully the position will be then that most restrictions will fall away. but we're continuing to look at the detail for that time frame. Now, nothing is final, so what I say is always subject to change in the light of changed circumstances. At the moment, our focus when it comes to the categorization of countries is on the prevalence of COVID in that country or region. Come July, we expect the focus to switch, with vaccinations being the primary consideration. That's a fundamental change in our approach. Finally, I do want to comment on something that we've been talking about now for the past couple of weeks. We were going to address that last week, but as I've explained, we had to rightly postpone the briefing last week. And it's the visit of Warren Gatland, the British Lions coach, to Guernsey. And I want to give our media colleagues some opportunity to ask questions. We've never shied away from questions. We've held these briefings regularly, and we've allowed any and all COVID-related questions without limits. We don't time limit people. We allow people to ask as many questions as is possible. Now, it's relevant that on the day we're talking about opening our borders once again, because from as soon as possible, as soon as it's safe to do so, we want to enable travel, and we want to show that Guernsey is open. It's open to our friends, it's open to our family, it's open to visitors, it's open to business, and just as appositely and appropriately, it's open to opportunities. I'm well aware how the visit has divided the community. It's happened for a number of reasons. Firstly, I would like to apologise for how we communicated the visit to you. We didn't tell you what was happening in advance. There was no nefarious reason for that. We had to work very quickly. The visit was arranged very quickly, and we wanted to take up the opportunity. And equally, we were conscious of attracting too much attention to a big name, and in doing so, create a risk for what was otherwise an extremely, and I emphasise the adverb, safely planned visit. When we were asked questions about the visit over the Easter weekend, we responded in haste, and if you do sometimes in haste, you repent at leisure, and we were a little clumsy with the information we put out. It wasn't correct, but it wasn't intentionally misleading, so we then had to correct ourselves. That's not right because it makes you doubt us, and you're entitled to expect any information that comes from us to be accurate. So again, I'm sorry for how we handled it. And this is a very, very important point. If you're asking me, Peter Furbrush, if it was right to allow the visit to go ahead to welcome Mr. Gatland and to try to make the most of a rare opportunity for us, I say unreservedly and absolutely. My answer is yes, it was the right thing to do, and I fully believe that. The decision was rightly made, and with my support. They didn't need my approval because it wasn't a political decision. It was not a political decision, but it was made by our experienced senior officers and not by politicians. That's in keeping, and entirely in keeping, with how other variations were made, such as those for critical workers or compassionate reasons. But in hindsight, given the sensitivity and the high profile, it may have been right to make it formally a political decision. But there's no one's blame for that, because you learn from your experiences. Didn't change anything, there was no change, not me passing the buck. As I said, I was fully aware of it and fully support it. And if I was asked to support it again, I would do so absolutely. Now, we've reached a stage where things are changing quickly. We're moving from a place where being closed to the outside world was absolutely the right thing to do, but it's not the right thing anymore, or at least not for too much longer. We've got to transition in a safe way, but not a fearful one. We cannot turn away an opportunity for our whole island that presents itself now because a month ago or 2 months ago we were enduring the hardships of the lockdown. That was then. We've got to move forward. When we entered into the last lockdown, we said that going into the lockdown was easier than coming out of it. Absolutely true. Coming out of it is very difficult. The judgments we have to make are also difficult. We have to balance the risks and the rules as we transition from being closed to being open. How fast we do it, whether we're being proportionate, are all questions that we have to ask ourselves. I and all my colleagues and our advisors ask ourselves that, repeat that question before we make a judgment. Now, we are now about to go through the biggest transition since this pandemic began, to a point where we will be opening our borders that have been virtually closed now for over a year, and where we no longer look to lockdowns as a way of protecting our community, because the vaccine is doing its job. We want you to feel comfortable, we want you to feel confident with the transition, but a transition is what we need to start making now. Now, the opportunity of Mr. Gatland came along suddenly. We took it, and we were right to do so. As I say, where we fell down is not doing enough to bring all of you with us, because you're our people, you're our friends, you're our family, you're our community, And again, I'm sorry. But would I be sitting here thinking, oh, should I have made a different decision? Absolutely not. The decision made was a good decision. Albeit, as I say, it was not made at political level, but it was made with my full support. Now, we'll take questions on that in due course, but our focus today, I hope, are the very significant decisions we've made, and I've announced of our travel rules. So I'll hand over to Dr. Brink, who's going to take us through some detail.
So thank you very much. And I would like to start off by saying that I am very sorry for what happened. And I think for me, it's a time to learn and to reflect. So thank you. So if we look at a general update, where we are, we look at wave one. Wave one, we had a total of 252 cases. Between wave one and wave two, it was relatively quiet. We had 58 cases. Most of those were travel associated, and we had that small outbreak in November, and that was rapidly controlled. Wave two was a totally different experience for us. It was caused by a variant virus, and what we saw was a really rapid spread of the virus and a profound involvement of children. And that really meant we saw a lot of transmission within households. So it was a completely different situation we were faced with. Our huge testing capacity that we have enabled us to control the situation really quickly. And then we finished wave two on the 22nd and 27th of February, and we went on into the post-wave period. And we had a period of time that we were virus-free. But a couple of days ago, we detected another case in a traveller. Everything was done correctly. They were detected on day one. They were in self-isolation. And again, it just shows that the systems work. So the fact that we detected a case is not of concern to me because it was appropriately managed and the person was in self-isolation. So I thought it would be useful to give you that overview on where we sit. The other the other thing that we actually are very proud of is our testing capacity. And we use our testing capacity very appropriately. So we have our diagnostic testing, we have our surveillance testing, and we also have our surge testing. So for the first time in wave two, we use surge testing. And we threw huge amounts of testing around various areas of interest. And that helped us control the wave. So in total, we've done over 91,000, just under 92,000 tests on the island, and we've had 822 positive. So that gives you an overview of all of the testing over the last year and a bit. Now, Deputy Fairbrush talked about the reintroduction of categorization, and I think it's really important that we do move forward and that people have less restrictive self-isolation as we move forward. And I thought it would be useful at this time to just outline what each of those categories mean. And I know a lot of you have seen this data already, but I'm aware that some people have been phoning us and saying, what exactly does it mean? And I thought just going through that would be important for the listeners and the viewers. So first of all, Category 1 is an air bridge, so no testing, no self-isolation requirements, nothing required at all. Category 2 is when you have a very low prevalence of infection, and that's less than 30 per 100,000. And what we'll then do is, as a test on arrival, you isolate until you have that negative result, and then you're allowed out and about into the community with a further test on day 7 if you are still in Guernsey. So if you then decline that testing protocol, you then go into self-isolation. So there is a choice there. During the time up to 14 days, we'd also want people to stay on passive follow-up. And I'll explain what that is in a bit more detail, but it isn't very restrictive at all. Category 3 is when we have between 30 and 100 per 100,000, and so it's sort of the intermediate group. And there, people will be tested on arrival and tested again on day 7, and will be allowed out to passive follow-up after the receipt of a negative result on day 7. So I think, again, that provides is far less restrictive. From my perspective, is just listening to what people have told me, is people tend to find the second week of self-isolation really, really difficult. And so many people have said to me, you know what, I can do 1 week, but the second week was hell. So again, it's trying to design things that are suitable and appropriate, but at the same time safe, but also taking into account people's comments. Category 4 is where a country has more than 100 per 100,000. So they've clearly got a lot of ongoing COVID activity. And And those people will remain in self-isolation for 14 days with a day 1 and a day 13 test. So the testing requirements and the self-isolation requirements are designed to keep the community safe, but also listen to what people are telling us with regard to self-isolation and make it as least restrictive as possible. So that goes through the prevalence categories. So I also just want to talk a little bit about passive follow-up. And if you look at our passive follow-up rules, it's all about protecting the most vulnerable in our society, and that's really important. So you have to be vigilant for symptoms, and we have to, if you have any symptoms whatsoever, and we've always had a very broad symptom classification. So we've always had things like headache, sore throat, diarrhea, so not only just the fever or cough or shortness of breath. So we've always had that broader diagnostic criteria, is come forward and be tested. Now, one of the things that we will be retaining forward towards the into the winter months is our clinical helpline. So people can see their GP, so primary care, go to their GP, they might be tested in the hospital, but they can also phone up the clinical helpline and get a test through the clinical helpline. But we want to be very cognizant of preventing or protecting the most vulnerable in our society. So if you're in passive follow-up, we don't want you to go into a nursing home or care and residential home. We don't want you to go into the hospital unless it's an emergency. Sometimes people will come in, for example, for an end-of-life visit. We can then arrange a specific method statement around that with PPE and so on. That if you do need healthcare provision during that period, just let someone know, or let the healthcare provider know that you're in passive follow-up. And where practical, and you don't have to be obsessional, but keep a list of where you've been. So if someone is in, say, Category 2 country and then comes up positive on their day 7 test, then we have an idea of where we need to contact trace. And that is extremely helpful for the contact tracing team. And then obviously under certain circumstances there might be specific restrictions, but that would be done on an individual basis. So passive follow-up enables people to get on with their lives, move around the community, but at the same time looks at how we protect the most vulnerable in our community. So we have the categorization. We said from July onwards we'd be looking at what the post-July considerations are. And what we've got to be cognizant of is that as countries become increasingly vaccinated, it's likely that testing will come down. So you've got to consider whether prevalence is going to be a reliable indicator as we move into the vaccinated population, or many populations being fully vaccinated. And so what we're going to do looking at July is looking at linking to vaccination status of countries. So if someone has an equivalent vaccination status down to us, is free travel between those areas, then is really a possibility. Also looking at people's individual vaccination status, again, another key criteria. What we'll also do, and what we can do, is look at the rate of infection. So although countries might not be doing large seroprevalence or large prevalence studies and doing a lot of surveillance testing, what we can do is see if they have outbreaks, and if some countries got a rapid increase in the rate of infection, that would be a red flag to us. And then the other public health concerns, so the emergence of variants of concern. Now, the variants of concern, we know the vaccines work very well for the B117, the Kent variant. They might not work as well for some of the other variants. So if you have a jurisdiction that has a high prevalence of vaccine, of virus that isn't sensitive to the vaccine, then that would be of interest to us. So again, it's trying to balance freedom of movement, people being able to move around, but at the same time looking at the safety of the population. So other things moving forward, and I always like to try and think of the other things that might be of interest to everyone with regard to moving forward. I think it's very likely that we'll have some sort of boosting program, that whether it's towards the end of this year, that's certainly a possibility, or into next year. And so there are a lot of unknowns at the moment, is when. So should it be now? Should it be next year? There's a lot of work being done on that. Who should get boosted? We know that some people who are older will have a less robust immune response, and their immunity might wane. Should it be, for example, priority groups 1 to 5? Should it be other groups? We don't know. So there's a lot of work, I said, being done on that. There's also some studies being done on whether you could concomitantly administer a COVID vaccine with a flu vaccine at the same time. At the moment, we can't give them together, but there are studies saying, could these be done together? So for the ease of administration, to be able to do both together would be helpful. And there's also a big debate on whether you get boosted with the same vaccine, so you have homologous boosting, or whether you get boosted by a different vaccine, heterologous boosting. So those are the questions that are being looked at. And we're very fortunate in that we have observer status on the Joint Committee of Vaccination and Immunisation, so we're able to hear these discussions, and they can help inform our decision-making. The other piece of work that we're doing at the moment is that related to Covert Certification. Now, Covert certification is going to be really important and something that we will need to integrate into our daily lives. But it's whether it's just vaccination, or whether actually Covert certification should be broader. So, for example, you have vaccination, you have past infection. Some people might require a negative test to go to a certain country or place, and it's whether you have a COVID certification as opposed to a very narrow vaccination passport. So that's what we're looking at. There's some debate on what the minimum data set should be. What we want to do is make sure that anything we produce has interoperability, so it can be used in other jurisdictions. What are the national requirements? What are international requirements? And I think that'll help us as we move on to greater connectivity. So those are two pieces of work that we're doing at the moment, together with what post-July looks like. So thank you very much.
Thank you. Our Chief Executive will go through some of the practical and operational implications of moving to country and regional categorisations. Paul.
Thank you, Deputy Fairbrush. As we prepare to ease some of the restriction at our borders from the 23rd of April, it's timely to remind everyone of the process they need to follow if they are intending to travel from the bailiwick. There is a lot of detail to cover, so I apologise. However, it will be available on the website as usual after this briefing. No matter what category, country or region a person arrives from, all travellers will need to create a travel tracker account. This includes travellers who have been given an exemption for critical work, compassionate or medical reasons. 2 days before arrival in the bailiwick, individuals who have a travel tracker account will need to register for their journey information. This includes date of arrival into the bailiwick, a travel history of the countries or regions they have visited, and the intended self-isolation address once they arrive in the bailiwick. We will publish a list today of what the Category 3 countries will look like based on the current prevalence data. However, I must caution that the data will be reviewed weekly on a Wednesday, when any changes will be published ahead of them coming into force the following Monday. If you are considering travelling in the near future, please take a look at these Category 3 regions. But bear in mind they will be reviewed again the following Wednesday, so are subject to change. At the weekly review of the prevalence data, Public Health Services will override country or regional classifications if they are concerned about the validity of the published prevalence data in a particular country, for example, due to low testing numbers, or in the event that a variant of concern or an outbreak of cases requires the category to be changed to protect our bailiwick community. In the same way, Public Health Services will be able to recommend an immediate change in category classification in certain circumstances rather than wait until Monday on the implementation date. Full details regarding the travel tracker and country or regional classifications can be found on the coronavirus website. For those of you considering using an inbound business tunnel with effect from the 23rd of April, it's important to note that business tunnels are limited to the same day return travel only. There are no mandatory self-isolation requirements, but travel to and from the airport hangars or terminals, buildings must not be on public transport. Social distancing must be maintained at all times and contact details must be recorded for tracing purposes. Obviously, contacts should be kept to a minimum in these circumstances. Business meetings themselves must be held in a well-ventilated office and, of course, not in public places such as restaurants or bars. Business tunnels will initially be provided by private aviation business only. As you know, commercial carriers do not currently offer return daily flights. Prior to the 23rd of April, full details on business tunnel requirements will be published online on the coronavirus website. Separately, we know some destinations you may travel to are asking for proof of a negative COVID test result before you go. So next week, we will be introducing online a form for people to book a pre-travel PCR-based COVID-19 test if you need it for travel reasons. Anyone who needs to book a test must complete the online form 48 hours before the test is required. A member of the scheduling team will then contact you to make the necessary arrangement and take payment for the test before they are carried out. PCR tests pre-travel will cost £83 per test. Our primary care colleagues have been providing this service in their own practices, and travellers are able to continue using primary care for pre-travel testing, but this new online booking service now ensures a full 7 days a week service. But remember, you must contact that 48 hours before your test requirement. Full details and a link to the new online registration form will be made available next week. But please remember, this test is only needed if your chosen destination requires a pre-travel negative test result. I appreciate that there's been a lot of detailed information in this briefing. As I've already said, a lot of this information will be on the coronavirus website either today or early next week. For those of you who work in the tourism sector, a targeted communication will be sent to you and your industry representatives this afternoon, explaining more about what this means for your business over the next couple of months. And finally from me, I had also intended to speak last week on the recent visit by the British Lions head coach. I think Deputy Furbrus has covered it today, and I fully support his comments. All I would add is that where operationally we could have communicated more effectively, I promise, as always, we're making sure lessons will be learned. I would, however, emphasise that a relatively small group of senior officers, including Dr. Brink and myself, have advised and supported the CCA continuously since the beginning of this awful crisis, as well as setting up all the operational requirements to protect the communities of our bailiwick. I can assure you all, our combined intent has been and will remain to act with the best interest of our community at heart. Thank you.
And I agree with that last comment. Thank you very much indeed, Paul. Right, ladies and gentlemen of the media, your opportunity to ask questions. And could you identify yourself when you say who you are? So, yes.
Hi, Zoe Fitch from the press. Just to talk quickly about vaccines. Have we seen any cases of blood clots from the AstraZeneca vaccine in Guernsey? And what reassurances can you give to people on that particular vaccine list?
Okay, so we know that the first of all, looking at the incidence of the AstraZeneca clots, it's about 4 in a million, so that's 0.000%. And if you have COVID, your risk of getting a clot, a wild-type COVID infection, your risk of getting a clot is about 165,000 per million, so about 16.5%. So it gives you an idea of the risk analysis. But what is clear is that there is this very specific syndrome of unusual clots, and they're in some of the vessels in the brain, some of the vessels in the stomach, but they're associated with a low platelet count as well. And so it's a very specific syndrome. So with regard to clots in people who've had vaccine in Guernsey, we'd expect to see a certain number of people getting thrombosis for other reasons. We have seen under 5 cases with any form of thrombosis, which we've reported to the MHRA through the yellow card system. And if the case is of interest to them, they will then come back to us, and they haven't come back to us on any of the cases. So they then do an analysis of the case to see whether they think that it's a part of the specific syndrome that they're looking at, and they haven't come back to us. But we continue reporting through, but it's under 5. I can't give a specific number because of the risk of identification with anything, but it's a handful of cases. And as I say, MHRA haven't come back to us asking us for any further details. The clots per se didn't seem particularly unusual to us, but we won't make that judgment ourselves. We'll let the MHRA make that judgment. Okay. So with regard, with regard to the assurance is that we are not using the AstraZeneca vaccine in the 20 to 30 5-year-olds. We made that decision prior to the Easter weekend. The announcement came up just after the Easter weekend, but looking at the data, we thought it was appropriate to offer people between the age of 20 and 30 an alternative vaccine. So they're being offered the Pfizer vaccine.
Thank you. Next question, please.
Kate Prout, ITV Channel. You talked about Airbridge with Jersey. Is that likely to be sooner rather than later, given how low their cases are?
Again, we haven't gone into detailed discussions yet with them. And again, it's similar with the Isle of Man, really. As I say, nearly every conversation I have with my equivalents in Jersey, the Isle of Man, we discuss it. The last one I had was with Howard Quayle from the Isle of Man. They're anxious to set up the Airbridge, so are we. That's a long way of saying I can't give you a definite date. I'd like to say it's tomorrow or next week, but that would be unrealistic. But I would hope it's sooner rather than later. And I'm sorry, that's not a politician's answer. It's the best one I could give.
John Fernandez from BBC Guernsey. Can I just get a bit of clarification on how you got to the figure of £25 for a test or for travel and £83 for the outgoing PCR test? What was kind of the thinking behind that?
Yeah. Welcome back, by the way, from Scotland. It's warmer here than Scotland, John. It's good. It's nice to see you. The £25 doesn't cover. Doesn't cover the real cost. It's a contribution towards the cost. And we were discussing outside of this room if we could give you the exact, it's £37, £42. We're not in a position to be able to do that, but it does cost more than £25. It's a contribution towards the cost. As to the 83, I'm going to turn to you, really, Paul, if you could throw more light on John's question.
Yeah, as you will realise, we use different types of tests and they're administered in a different way. And clearly, the requirement for a pre-travel test, so someone leaving the bailiwick because their point of destination requires them to have a negative test result, will need a very certificated a copy of a full PCR test. So obviously the cost would have been administrating that and getting it ready for the traveller are slightly higher. So that you will see tests going forward for different reasons, whether that be business tunnel, whether that be private travel, whether that be for compassionate at different levels, depending on the requirement.
So, there's also a slight difference in that if you need a pre-travel test, it's usually an operator-taken test that then needs to be taken. It needs certification, you need a certificate produced, whereas the incoming travellers, it's a self-taken swab, and you get a text result. So operationally, it's actually easier. One's far more labour intensive than the other.
Next question.
How is the vaccination programme going? And are we still getting our proper quota from the UK? And do you have a date when you expect everyone to have had their first jab at least?
Basically, it's going well. Funny enough, I had one of my sleepless nights last night, and I was thinking about what percentage of, it's a bit sad, I was thinking about what percentage of over 60s had had the vaccine, and we talked about it this morning, and the uptake of the vaccine in the over 60s has been in excess of 90%. So really, really good. Our figures this morning, we've delivered just over 43,000 vaccines, 43,007 to be precise, and we use the metric of per 100 population because it's a comparable metric, and our metric now per 100 population is 65.4. So doing really well on all of those parameters. So with regard to the vaccination program, we're starting phase 2. So the 40 to 49-year-olds are being called in now. We expect to have delivered the first dose to all of the phase 2 program by the end of June, with the second dose then obviously coming in after that. So it's going as well as could be expected. We're still getting our vaccine supplies. Moderna has completed its approval, and we'll start using that when we get supplies of Moderna in, so we're ready to deliver that. There's another vaccine that's being considered by JCVI at the moment, so we expect to see more different types of vaccine available to us. So we are very pleased with the progress. But as always, we owe a huge debt of gratitude to those vaccinators who are often doing their day job and then going and vaccinating on their days off over the weekends. and the support that we've had from all of those vaccinators has been incredible. So we do have to say a big thank you to all of them.
Thank you. Thanks for the question. Anybody else with another question? Zoe and then.
What's the reasoning behind staggering the introduction of categorization of country or region as opposed to introducing them all in one go?
Well, because we did talk about that long and hard. And the idea was we want to take the community with us. And there are still some people, and rightly so, that are saying we're going too quickly, etc., etc. And also we want to make sure that when we start the categorisation week today, the 23rd, that it will work. We believe absolutely it will. So that's the idea. And we thought 3 weeks then between the 23rd of April and the 14th of May, which will be the next pretty big step to go from Category 2 to Category 3 to Category 2. Because as Dr. Briggs explained under the slides, and they're going to become mythical, these slides, in the future. People are going to Dr. Briggs' slides will be part of Guernsey history. But the Category 2, you take your test, you hopefully get a negative test, and then you'll still be, you've still got the passive things that you've got to do, but you can go about your business then. So it really is a big, big step. Paul, do you want to add?
Yeah, I was just going to add, I think that last point is a really fair one. We're actually seeing the UK doing really well now with their own vaccination regimes and prevalence levels dropping and really progressing well. So what that really would mean, in effect, with so many regions becoming Category 2, you would quite quickly see travellers being able to come to Guernsey with only waiting for their test result on arrival, then sort of going at large. And I think that would be quite a big step to take. And I think that the CCA politically discussed that at length and really bounced it around. So I think, it's only a short period of time, but as ever, allows us to test what we've put in place. And then quite swiftly in May, moved, hopefully, fingers crossed, to the more productive regime.
Yes, this kind of relates back to something which you mentioned a few weeks ago. It was one of the slides that you mentioned, Mr. Fabrish. It was the fact that we had a positive case with 20 plus contacts about 2 weeks before lockdown on one of your slides, Dr. Brink. I'm just wondering, what situation can you have a positive case with 20 plus contacts when presumably they went into isolation on arrival, if it is a travel associated case? I'm kind of hinting at, do we know what caused the second lockdown?
So the answer is it wasn't that case, and the simple answer to that, it was a packed plane. And so when you contact trace a plane, you go a certain amount of rows in front, certain amount of rows behind and either side. So you can see how the numbers will add up pretty quickly. And then if you have a group of people travelling, a family group, you can see how you can get to 20 contacts pretty quickly. So it was a very packed plane that came in.
Yes, Aaron.
Aaron Carpenter, Bailiwick Express. Regarding travel, Dr. Brink, you mentioned earlier that you might look to a country vaccination status in addition to or instead of prevalence rates in the future. You also gave brief reference to an individual's vaccination status. Does that mean vaccine passports?
So it's a Covert Certification, which I was talking about in my last slide, is that I would see vaccination status being part of a Covert Certification. So people are going to require different things. So I think a lot of Covert Certification is going to be vaccination status, but they are going to have people who've had past infection, who cannot be vaccinated for whatever reason, might require a negative status. So that can be pulled together in a Covert Certification. So I absolutely see vaccine status being something that can enhance travel in the future. With regard to link to a vaccine area, is you're looking at an area with a comparable risk to yourself. And as I said, the moment vaccination levels go up, my feeling is that testing will go down. So prevalence, so calculating prevalence on the numbers of cases per 100,000, which we're doing now, will become a less reliable indicator. And so linking, for example, if the UK has got a very similar vaccination status to us, is you can then have free travel between the UK, Guernsey, Jersey, Isle of Man, whatever. This is just hypothetically speaking, and that'll enhance people's ability to move in a safe way.
I think also we do get posed the question an awful lot of why haven't we already introduced some form of vaccination passport or certification now, so people are ready to go. We are working really, really closely with the UK. The UK themselves haven't decided what the vaccine certification looks like, but also we want to talk with friends and colleagues in the Isle of Man and Jersey, because obviously Crown dependencies, if we can have something that is very similar and works, then surely that's going to assist us when moving across the borders. So we are working, we are communicating, and we will have something, hopefully, and something that's really effective, like based on an application, not simply just a paper requirement.
But in the interim, what we're doing is, because I have had several people say to me, I need my vaccination status to go, and I can't just obviously have a card, is for people who require it as part of their travel, is we're giving them letters.
Okay, next question, please.
Kind of follows on from Aaron's question. Is there a concern that with this COVID certification, and I suppose this is for you, Deputy Fairbrass, that with young people being vaccinated much further down this process, that you may create a bit of a kind of a two-tier system that could alienate people, young people especially?
I think that's true. That's a fair point. If everything could be done at once, it would be fantastic. But we want to make it as fair as possible. But it can't be entirely fair because of circumstances. Because the idea of vaccinating the older people first, because they were most at risk, and Dr. Brink's given me the statistics many times about how likely you are to die or suffer serious injury if you're a certain age and certain age. But it will take a time. We're going to do it as quickly as we can. But will it meet the test of fairness? It'll be as fair as it possibly can be without, being... There'll probably be some professor at some university will say that it doesn't meet this sociological or whatever it may be, but we've got to live in the real world.
So forward planning, and to give you a more precise figure, forward planning is that we would expect priority group 10, which is phase 2 of the vaccination programme, to have had their second doses by the end of July.
Yeah. Right,
so,
question. Oh, sorry,
yeah,
Dr.
So it's just
keep interrupting you.
That's right, it's okay.
Okay. Next question, anyway.
I feel I do need to ask a Warren Gatland question. Do you
Yeah.
think the way you handled it, that initial disclosure and then the island's reaction, actually cost us the Lions tour?
I don't think so. I think what I didn't know, because I wasn't alert to it, is that, and I should have done, it was a public thing, Mr. Gatland went over to Guernsey for 4 or 5 days in February, I think, where their risk of prevalence at that time was much higher than ours is now, and he was allowed a free rein. We adopted a much tighter regime because the overwhelming consideration was safety. And I think what he told you, Paul, or you heard, was that their facilities were better. Is that the way? Is that a fair way of putting it?
I think it was an assessment visit to see the suitability of a location. We were given very short, just to give you a little bit of knowledge or understanding of how quickly we had more or less 24 hours to give a no-go answer whether we'd want to accommodate them. They were, as Deputy Fairbrass has well said, they were already closely looking at Jersey, but then thought actually there might be a benefit to look at the other island or both islands. And so therefore, because time was limited, because they were due to make final decision, there was the forthcoming weekend. So we literally had 24 hours to make the decision. And based on that, we had virtually one working day in order to look and accommodate the assessment of suitability as Guernsey as a location. That include obviously things like, did we have a training ground, did we have a suitable hotel, what was the distance of travel, but also important things that they would require, such as a conditioning gymnasium of scale to cope with the sort of numbers they were looking at and the quality they were looking at. I don't think we could quite match the Jersey offering in that space, so it wasn't an open and shut case that we would get it.
Yeah. And there were lots of we've got good facilities here, and we had 2 of our very well-known local residents who would have supported it, and they got significant rugby connections, so that was there. My view now, this is Peter Fairbrass, nobody else saying that, I don't think it helped. I think the decision was made by Mr. Gatland on the basis of what Mr. Whitfield has said. I don't think it was helped that there was so much negative publicity. We did our best, we did it quickly, everybody acted in absolute good faith. I've been accused of dishonesty over it. I take that very, very, very seriously. And if everybody accuses me of dishonesty, they can expect me to exercise my rights very fully indeed. I acted at all times in good faith. So did everybody else. I just think it's a shame that what was a thing that was done for the overwhelming good of Guernsey should have ended up with a bit of a sour taste. That's me saying that. Perhaps I'm not being as diplomatic as I should be. Eric.
Have you had any contact directly from either Lions PR representatives or Mr. Gatland himself to explain why they don't want to come to Guernsey?
I certainly haven't. I don't know, Paul.
No, the third-party agent who was the contact point for the British Lions approaching government, and they politically approached government, and then we looked to see if it was feasible in a very short space of time, did report back that they felt there was two aspects. There was the gymnasium, but also that they were looking for a very positive experience for the team, and clearly there was, as we've seen, a reaction within the community that mightn't have provided such a positive experience. And as I think is expressed by Deputy Furbrush, it's a shame because it would be a wonderful opportunity as we unlock and open Guernsey to say how we were open for business and that experience.
I think in relation to that, our paramount concern at all times was safety. That was never prejudiced at all. And I took real exception that criticism was made of Dr. Brink and her team, and all they did, a very important all I hasten to add, was produce a method statement. We have benefited so much from her and her team that criticism was completely unacceptable. Criticise me, I've got broad shoulders, and I'll deal with it, and if anybody wants to have a battle with me, well, they'll have a battle. I think it's just so unfortunate. Somebody said to me, and I don't, I'm a Guernseyman, somebody said to me, Jersey grabs opportunities, Guernsey sometimes grimaces at them. I don't think that's true anymore. It can't be true anymore. But I don't think we cover ourselves in the greatest of glories. Next question, please.
Carrying on just on the Gatland theme, can we find out what expenses may have been incurred by the states during that visit? Were there any kind of, the testing expenses, etc.? What was incurred there?
Yeah. I actually asked Paul that question before we came in because I wasn't aware we'd incurred any. I'm not saying we didn't. I don't think we incurred any or much, Paul, I think. But, we will give a definite answer in due course, but I think that's probably the position. Is that a fair summary? It
was little or nothing. Most things were covered by private enterprise and other people supporting the agency in the tour itself.
Next question.
I suppose I'm getting into the weeds of it, and this will be my final question. Do we know who attended both of the meals, the meal at the Guernsey stand and the one at St Pierre Park?
I didn't attend the St Pierre Park one.
You attended both?
I didn't attend one, and I wouldn't regard to call. You got there. I had a bowl of soup before I went there because I was going for an hour, and I was there for an hour and 10 minutes because, being interested in sport, I asked him some silly questions about who would you pick, and he didn't answer them, quite rightly so. But I was there for about an hour and 10 minutes, I think, and I went out I had some personal stuff afterwards. I didn't regard it as a meal. There were a few sandwiches. If that's a meal, then I would, as you know, I've got interest in hospitality. If somebody did describe that as a meal, I would be saying we should do better. But I attended that. About 10 of us, I think, including Mr. Gatland. I'll turn to you, Paul, for the other meal. For the meal rather than the other meal.
Quite. The day wasn't designed around meals. Quite plainly, there was an objective to one day. The objective of the one day was to carry out a location assessment, whether it was a viable opportunity for the British Lions to hold a touring camp here for part or whole of their training camp tour. So therefore, there was work to be done in the day. The day was split into two because following the method statement agreed by Public Health, actually we needed to keep numbers to a minimum on two. So therefore, the lunchtime was about government acknowledgement, support in principle, because obviously there was no answer whether the tour would take place, and more importantly than anything else was public health. In other words, they were looking at our public health. What did we have in place? How would the team be in a safe environment? As well as our desire for them to be in a safe environment. So those questions, and also, as outlined, we have a couple of good citizens in the island that are connected outside, including being able to financially maybe support elements of that tour. In the evening, it was more about equipment, what would be need from a conditioning point of view. So the day was split in two, so there were two small groups.
Any other questions? Yes, Aaron.
In your original press release, you stated that a visit would likely provide a boost to the economy and in doing so promote the positive and safe position the island has achieved. Have there been any other instances since the start of the pandemic where senior officers and or politicians have approved visits which are not critical workers, do not fall into business tunnels and are not made for compassionate reasons?
Yeah. I'm not sure it's a like for like. I mean, it's a fair question. I don't know the answer to that. Dr. Brink, do you know the answer to it?
No, I'm afraid I don't.
So it's not, again, not wanting to do it, but we're moving out this pandemic now, as we've said. So there are going to be other opportunities. We've talked about the relaxation of restrictions, etc., shortly. So we were in a different position when the visit was made by Mr. Gatlin, a fortnight ago now, than we were, say, a month or 2 months or 3 months before that. And things change. You've got to make... Mr. Whitfield's made it very clear, a very early decision. We didn't have a lot of time. The people of Guernsey, didn't have a lot of time, so the decision was made, to use my phrase, expresso presso.
Just a final question relating to Zoe's first question. If somebody between 20 and 30 has already had their first AstraZeneca jab because they may be in one of the vulnerable categories, what are you recommending they do? I can imagine this is a small cohort, but I can imagine there are also people who are quite worried.
So JCVI has been very clear on their recommendations there, that you have the AstraZeneca for your second dose. The signal has come up as we think it's an idiosyncratic type of reaction to the first dose of the vaccine. We don't know what the mechanism is. It seems to you get a clot with low platelets, and sometimes there's some antibodies that flag up as well. But it does appear to be a response to the first vaccine, and so the advice is that people have their second vaccine as per normal. It's also complicated because data on heterologous programs is just not there yet. So they're running a big study in Bristol. I'm sure you're probably aware of that at the moment. So they have the second dose of AstraZeneca. Obviously, if someone's had a clotting complication, the advice would be different. But if they've had the first dose and they haven't had any clotting complications, you go on and have the second dose with the same vaccine.
Anybody else a question? Yes, sorry.
Why is Guernsey using a 14-day figure to calculate prevalence rates of COVID when the UK is using 7 days? Do you think that could lead to any confusion?
No, because we publish it on our website, and what you're doing is you're looking for a stable... so we look at a 14-day rolling figure, but we calculate it over but it's a 7-day period. So we look at it over a 7-day period, but it's a 14-day rolling figure. It means that you don't bounce between categories. You saw some of the things that happened with the UK changing status very quickly, is that it's a very stable way of doing it. And it means that we won't put something in a category 3, then it bounces to category 2. So it gives you a more precise analysis of trend. And I think as long as we publish it honestly and transparently, when I speak to people, what they want to do is they want to know where they stand. They don't want to say one day it's this, the other day it's that. They want a very stable way of being able to assess their risk. And I think that gives them that. It's published, it's open, it's transparent, and I think we would be hard pushed to change from that because it's safe.
Okay. Any other questions from anybody? Is that order? No. Well, thank you everybody for their questions. And I'd just like to say this in closing. The work over the last 13 or 14 months by our nurses, by our doctors and by everybody has been truly, truly fantastic. Care workers, so many other people in the community, bus drivers, everybody. I've been doing this job now for about 6 months. The work, and the work of the senior civil servants, the very small senior civil servants team, has been truly, truly outstanding. They've worked long hours, they've given good advice, and they've always acted in the best interest. So for some of them to be criticised over what's happened recently, I take exception to. And again, Dr. Brink and her team have been, if there was a beyond the call of duty, and we talked about that with His Royal Highness the Prince of Edinburgh, Duke of Edinburgh recently, they've done it so well for so long and with such such quality and such integrity. I just hope the people of the bailiwick and everybody in the bailiwick appreciates that. And I thank you all for your questions.